Welcome to our health discussion on the youth vaping crisis in Canada. My name is Abigail, and I'll be starting us off. In Canada, youth vaping has been on the rise. A large part of this is due to the desirable flavors in e-cigarettes, which appeal among teens. In June 2021, the federal government proposed restrictions on e-cigarette flavors, such as cereal milk, cotton candy, and dragon's blood, to name a few. There has been a call to action to change the Tobacco and Vaping Products Act to make vaping products less appealing to youth. However, since then, there has been little action taking place, both from the federal government and Health Canada. Although Health Canada created new regulations on the amount of nicotine allowed in e-cigarettes, they have not enforced any national regulations on flavor restrictions, resulting in a 2-year-half delay. Since then, the vaping industry has expanded its flavors and production, leading to a surge in youth vaping. In the 2021 Canadian Tobacco and Nicotine Survey, it was revealed that fruit flavors are the most popular and widely used among Canadian vape users. As such, multiple provinces have taken it upon themselves to ban the sale of most e-cigarette flavors. However, with no national regulation in force, provinces such as Ontario and British Columbia have allowed the sale of almost every flavor in e-cigarettes. This allows for millions of underage youths to have limitless access for regular use. With appealing flavors and packaging readily available, youths are susceptible to developing vaping addictions. According to the National 2021 Canadian Tobacco and Nicotine Survey, roughly 13% of teens aged 15 to 19 said they vaped at least once, while only 4% of adults report to have vaped. This reveals how more teens are vaping at considerably higher rates than adults aged 25 and older. In 2020, almost 500,000 Canadians reported to have vaped, but not smoked. While vaping rates have increased, smoking rates have decreased. However, vaping has not been approved as a smoking cessation aid. The neglect of public health legislation results in the normalization of underage youth vaping, affecting both the mental health and physical health of teens. It is essential for nurses and health professionals to understand how vaping appeals to youth. By addressing the lack of action in youth vaping prevention, nurses and health professionals can learn how youths become addicted to e-cigarettes and formulate effective care plans for their recovery. The more that youth vaping is neglected and not addressed, the more will become addicted, leading to the deterioration of the mental and physical health of Canadian youth.
Hello, my name is Roxy, and I'm going to talk about our two peer-reviewed articles. The first article is Unpacking Vaping in Schools, Voices from the School Community. Data was collected from the individual open responses, group brainstorming, and open group discussions from the demographics on the left. The researchers focused on understanding how vaping was perceived in schools to find a connection between these descriptions and the patterns of use. This graph demonstrates why these demographic observed believe young people vape. Students were more likely to cite social norms, mental health, and or sensation seeking and pleasure seeking. Students also noted that they saw peers use it to cope with family problems and poor self-esteem. On the other hand, parents and staff are more likely to cite peer pressure and that teenagers probably thought it to be safer than smoking. Parents also believe that the mental health components developed because of vaping. Overall, school creates a hostile environment for growing minds, forcing extreme decisions for the youth. The second article, The Vaping Epidemic Calling Nurses to Action, pinpoints the nurses' role amidst the rise of e-cigarettes or vaping-associated lung injuries, or EVALI. CDC observed a rise in acute lung injury linked to vaping with over 2,800 cases of EVALI and over 60 deaths across America, with half of these patients under the age of 25. Hence, a checklist is used by nurses to establish safe and effective discharge of EVALI patients, and it was standardized to enhance their quality of life. The critical role a nurse plays in discharge education using patient-centered communication must also be fulfilled to intervene in this youth vaping epidemic. CDC tasks nurses to ask, inform, advocate, research their patients and the community alike. These will be further discussed in the nursing implications.
Hello, I'm Taya, and I'm going to be talking about the cultural considerations. So once again, the health concern is vaping crisis in youth, and within the youth age group, young people are intrigued in the flavors of these e-cigarettes, which is one of many more issues relating, but also in the school settings of peer pressure and cultural norms now. So within the cultural aspects of the vaping crisis, depending on the situation wise, this concern can be both marginalized and privileged. Marginalized essentially being outside of the circle of society, limited opportunities, and the loss of voice. In the school setting, students are wanting to fit in with their peers, feeling pressure with the social norms with the usage of e-cigarettes. Plus, with the normality, students are feeling the lack of confidence, especially if they're being offered an e-cigarette. Not accepting results in young people feeling shame, which is causing students to have mental health issues. Using e-cigarettes, youth are using it as a mental health coping mechanism with stress, anxiety, and to numb the pain, as is stated in the peer-reviewed article Unpacking Vaping in School, that results in addiction. Having these health concerns in youth has been seen as a privileged point of view. Privilege is having the advantage or immunity. As I said before, within the school social norms, students are using e-cigarettes to fit in with their peers. In the article Unpacking Vaping in Schools, students are using these e-cigarettes to feel empowered, stand out, to be rebellious and popular in school due to the social norms within the school environment. With further connecting the accessibility of these e-cigarettes as being easily accessible through friends or family, and as I said in the beginning, being intrigued of these flavors is due to how available many and how many flavors are being produced and how available it is within the community of the youth. To add more to the cultural aspect, it is believed that youth see e-cigarettes as cheaper, cleaner, and healthier. In the article Unpacking Vaping in Schools, teenagers believe it is not as harmful as cigarettes. And without youth not knowing the health concerns, it's resulting in more addiction, cancer, and even death. As with social media, it is normalized within the culture wise vaping for youth, which is being influenced by social media and amongst celebrities.
Hi, my name is Diana, and I will discuss the philosophical nursing approach. Critical social theory is used to convey the importance of acting against vaping and e-cigarettes. It focuses on the trends in pointing towards the increasing risk of vapes and e-cigarettes on users by using different flavors to attract consumers. The author draws attention to the government's lack of involvement in resolving this issue, which aligns with the goal of exposing the vaping industry and the government's power imbalance over society. By not implementing restrictions, the government implies a lack of care for a citizen's health on a mental and physical level. Moreover, the journalist uses information from experts, statistics, and health advocates to bring to light this issue, offering a more comprehensive range of opinions and as a trustworthy source of information. But people tend to resonate with individual experiences and feelings, allowing them to understand the issue on a deeper level. Voices from those who are affected, like e-cigarette or vape users, their parents, teachers, nurses, or other healthcare workers, and even communities, would provide a bigger picture and perspective on their experiences while strengthening the impact of the policy in real lives. This would align with the phenomenological approach, focusing on people's subjective experiences to help set a framework for the issue at hand. The author also limits our thoughts and emotions for the story by presenting a much more objective approach. The subjective approach would have resonated on a personal level and have made the concern of e-cigarettes a priority to resolve.
My name is Jack, and today I'm going to talk about the nursing implications. The clinical implications has four major things. The clinical stability, which makes sure the patient is stable within 24 to 48 hours before discharge. The follow-up appointment, scheduling a follow-up appointment within 48 hours for primary care and 4 weeks for post-discharge. A specific recommendation is a tailored care for a specific group. For example, pediatric patients who have a risk for adrenal crisis will be recommended for a tailored care. Patient resources, evaluating and arranging resources to better support the patients, such as mental health resources. The nursing intuition has four major approaches. The first one is gathering much information as possible, which may contain the past history of vaping or e-cigarettes, of the device name, the substance it contains, the duration of it being used. And the second is information, partnering with the local school and raising awareness about vaping risks and counseling parents and also communicating of bringing awareness towards this topic. Advocate engaging with the government for funding research and support for regulation on vaping and e-cigarettes on research, being updated on vaping related studies to inform the best practice of the patient's care.